Hey everyone, welcome back to another episode of the Speech Space Podcast, which is a podcast full of tips and resources for SLPs. I am your host, Jessica Cassidy, and this is episode 112. So today we're going to be talking about sensory processing basics for SLPs. Before we jump in, I did want to mention that this podcast is brought to you by the Digital SLP membership site, which is a site that features time-saving, interactive digital resources that are all teletherapy platform friendly. You can learn more about that or sign up for a free trial by heading on over to thedigitalslp.com/digital SLP. All right, so let's go ahead and get started. One thing I want to be very clear about before we dive in is that occupational therapists are really the go-to source of information about all things sensory. And the information that I'm going to be talking about today mostly comes from the world of occupational therapy. At the same time, a student's sensory experience of the world plays a huge role in their ability to feel safe and to engage in speech therapy. So it can be incredibly useful for SLPs to have at least an introductory understanding of sensory processing. Having some basic knowledge of sensory vocabulary also helps us to collaborate more effectively with OTs. But most of us probably did not learn a lot about this in graduate school, so our information and understanding may be pretty limited. That's why I'm so excited to cover an overview of sensory processing in today's episode. There are also some great courses and certifications out there for SLPs who are passionate about developing their own sensory knowledge base. So I will make sure to link to those in the show notes. And if anyone listening gives that a try, please do reach out and let me know how it goes. As we move into some specifics, one of the first things I want to address is terminology. Sometimes we hear clinicians talking about sensory processing, and sometimes we hear clinicians talking about sensory integration. The bottom line is that the terms sensory processing and sensory integration are ultimately referring to the same principles, although some clinicians and researchers do identify subtle differences between the terms, and there has been some controversy about this in the OT world. Currently, the American Occupational Therapy Association recommends that providers use the full term sensory integration and processing. That could get a little long for a podcast, so I may also use terms like integration and processing interchangeably. Just know that in articles, reports, and assessments, sometimes you will see people use one or the other, but they largely mean the same thing. Okay. Now that we know that sensory integration and processing are mostly referring to the same ideas, what exactly are those ideas? Basically, they refer to how our brain and body use information from sensations to understand the world. This information comes in through our 8 sensory systems. Most of us are more familiar with some of these systems than others, so I'll talk about all of them briefly. One thing to remember is that they really are systems, and they work together, and they each have more than one purpose. The first of the 8 sensory systems is smell. It's also referred to as the olfactory system. This system helps us become aware of threats through the smell of smoke, for example. It's also strongly connected to memory, and it helps us experience the flavors of the food we eat. It plays a role in attachment as well. The second of the 8 sensory systems is taste, and as we know, this system is related to feeding and eating, as well as comfort and self-soothing. It's also connected to attachment and threat detection, which might be surprising. The taste system is also called the gustatory system. The third of the 8 systems is touch. It gives us tactile information and also tells us about temperature, pain, and itchiness. The fourth of the 8 sensory systems is the visual system. It helps us to be aware of threats, connect to other humans, and understand where we are in space. Next up is sound, or the auditory processing system. As SLPs, we know that the auditory system is complex and plays a very significant role in hearing and communication. However, we might not know that it also plays a primary role in safety as well as in helping us figure out where we are in space and time. And it also gives us information about movement. So, those first five systems are what we know as the five senses, and many of us are pretty familiar with them. But there are three additional sensory systems, and they also play a very significant role in how we understand and navigate our environment. The next sensory system is the proprioceptive system, and this system incorporates information from our tendons, muscles, ligaments, and skin to help us understand where our body is in space. It basically involves awareness of where our body is and what it is doing. Next is our vestibular system, which tells us how and where we're moving and how fast we're going. Along with the proprioceptive system, it helps us know where we are in space. It also tells us where our head is relative to the ground. The eighth and final sensory system is called interoception. And this is one that researchers have only more recently started to understand in more depth. This sensory system is all about our internal sensations, like the ones that show us we're hungry or that we need to use the restroom. Interoception can also give us information about our emotions. The sensory system is really, really fascinating whenever you think about it. And if you're interested in learning more, Kelly Mahler is one of the leading OTs who is doing a lot of great work in this area, especially when it comes to treatment ideas that address interoception. So I will be sure to put a link to her website in the show notes. As I have been learning more and more about sensory integration and processing, one piece that always stands out to me is how much our senses communicate to us about safety. So it's logical that if a child is over responsive to certain types of sensory information, the world could really feel like a very scary and dangerous place most of the time. And then, of course, if a child is under responsive to certain types of sensory information, their actual safety and well being could be impacted because they might not be detecting threats in their environment or recognizing the body's hunger and pain signals. With this understanding, we can be better advocates for our students and clients. For example, a student might get labeled as having difficult behaviors at school, but we could help the other school staff members understand that the student may actually be acting in certain ways because they feel chronically unsafe. We'll address additional tips for SLPs near the end of the episode, but for now, let's move into talking a little bit more about the different types of disordered sensory integration and processing that we might see with some of our students. We already talked a little bit about the first category of sensory processing disorders, which is sensory modulation disorders. This is related to our degree of responsiveness to sensory inputs. One thing that's important to remember with sensory modulation disorders is most people have different responses within different sensory systems. Someone could be over responsive to sounds and smells and under responsive in their proprioceptive and interoceptive systems, for example. The second category of sensory processing disorders is sensory-based motor disorders. With these types of disorders, a person has trouble coordinating motor movements. Posture and balance can also be affected. These are important for SLPs to know about because they can directly impact speech and language. For example, although sensory-based motor disorders usually affect whole body movements, there can be underlying difficulties with planning and sequencing that affect many aspects of speech and language. Many of these students also have co-occurring childhood apraxia of speech. With students whose posture is affected, they may have a hard time sitting upright for long periods of time, and it may be challenging for them to maintain the breath support needed to work on articulation tasks. For these kids, it can be really useful to try out some specialized or non-traditional seating options in their speech sessions, and our OT colleagues can be a huge help with this. The third broad category of sensory integration and processing disorders is sensory discrimination disorder. This affects a student's ability to interpret incoming sensory information accurately. And as SLPs, we are probably most familiar with what happens when it affects the auditory system and is diagnosed as auditory processing disorder, but it can affect any of the sensory systems. For example, a student experiencing sensory discrimination disorder in the proprioceptive system may have trouble figuring out how much force they need to use to do things like, to say, throw a ball, or they might play very roughly even without realizing it. When it comes to disordered sensory integration and processing, OTs will almost always be the clinicians who lead the evaluation and diagnosis process. They have some really amazing assessment tools that help them dig into the specifics of which sensory systems are affected and how that plays out for an individual student. For us as SLPs, it's important to know that the DSM does not yet recognize a standalone diagnosis of sensory processing disorder, although many OTs are advocating for this change. However, there are many established diagnoses that are known to have associated sensory processing differences, including autism, ADHD, anxiety, depression, and learning disabilities. Okay, so now that we've covered the basics of the 8 sensory systems and the 3 main categories of sensory integration and processing disorders, let's talk about how all of this relates to SLPs. I already mentioned the concept of advocacy, and I do think this one is so huge for us. We can play such an important role in talking with teachers, parents, administration, and paraprofessionals, and helping them to understand that students with sensory needs are not being lazy and they're not trying to be difficult and they don't have behavior problems. We can also adjust our own practice to best serve students with specific sensory needs. And this could look different depending on the characteristics of the kids that we're working with, but the ultimate goal is making sure that they feel safe and regulated and ready to learn. If they have interoception challenges, we could do a restroom and drinking fountain stop as we walk students to speech to make sure that they are taking care of their internal needs. If they are over responsive to visual stimuli, then we could adjust the lighting in our speech rooms and reduce visual distractions. If they are under responsive to proprioceptive input, then we could provide squeeze balls or take a running break outside. If their posture is affected, we could change up the seating options in our speech room. Another way that we as SLPs can support our students with sensory needs is through co-regulation. We talked a little bit earlier in the podcast about how sensory differences can cause students to feel unsafe and dysregulated, and often we can make some environmental modifications that help with this, but they're not always enough, and we can provide additional support through co-regulation. So, co regulation is an interactive process between a caregiver and a child where we provide sensitivity, warmth, and structure. In this way, we can be a sort of comforting buffer for a child who is experiencing dysregulation. Co regulation is also important because it actually helps our students learn self regulation skills through the models that we provide. Now, of course, in order to model self regulation, we actually need to be self regulated. And that's one of the many reasons why self care for SLPs is genuinely so critical. Finally, and most importantly, we can collaborate with OTs as much as possible. I know this is not always easy, especially in the schools, but the benefits for our students and for us as professionals are just so enormous. We have so much to learn from one another. Speaking of learning, I really hope that you have enjoyed learning a little bit about sensory integration and processing in this episode. We really just scratched the surface today because there's so much great information out there, and the list of references and resources in the show notes will be a little longer than usual in case you want to do some exploring and further learning. In particular, I just want to highlight the book Divergent Mind by Janara Nirenberg, as well as the posts and articles from the Autistic OT. I love these resources because they help us understand the actual lived experience of having sensory differences, and this enables us to be more empathetic to our students. I'll absolutely link them in the show notes as well. Thank you so much for listening today. If you enjoyed today's episode, I would be very grateful if you would take a moment to leave a 5-star review to make it easier for fellow SLPs to find this show. We release new episodes twice a month on the first and third Tuesdays. Also, please don't forget to check out thedigitalslp.com/digital SLP if you're interested in exploring the membership and other content.